curious. Keep the upper chamber empty. And once you finished your MBBS, how did you move on? Because you are one of the few women general surgeons. Generally, women means you move into gynecology. How did you choose surgery when at the time there were not too many women surgeons?
So,
And did you face any kind of gender bias in your entire study of surgery?
so I took up surgery because it was very challenging. Same here, the same logic applied here also. Like physics was where you don't see anything. Same as medicine, where it is trial and error of giving tablets. You don't see any reaction is only by the symptoms, but you don't actually see what reaction is happening there. Whereas surgery, you see them macroscopically, what is happening, what you're doing. And it was more a daring type of thing. Second was like during when I was doing internship, people with ladies with private part problems who would hide themselves because they can't show it to somebody. 50, this is about 40 years ago, 45 years ago, you can say. So they would come only when they were terminally ill. So, and when they were being examined in the wards, general ward, there was no proper cover for them. All the men would be standing around. And it is really hard to, for me also, if I am on the other side of the table, I also will avoid showing it to me. They say like you should not hide anything from a doctor, but humanly it's not easy to digest. It's quite difficult. So that's when I thought I should take up surgery. Though there was little opposition from my father and initially and his friends who were advising him, but I said, no, I'm taking surgery. That if at all I'd go for further studies, take the trouble of studying, burning my youth, I'll go for surgery.
Wow, I like that burning my youth rebel attitude. But surgery, were there a lot of women there? Because women normally get into gynecology, but
Yes,
general surgery is not a place where you see a lot of women. How did you handle yourself in such a space?
There was a classmate of mine who also joined along with me. So we had good company there in the wards. And HOD we were in HOD's unit. So we were really pampered. We got to do more cases than the men who were around me.
Okay. So looking back now on those initial years, normally even the patients feel safe with men than with women. So how did you cope with that bias?
So when I started my practice first, I was wearing chudidars and going to hospital. And slowly, one by one, I started realizing patients would ask, "Neeve martira operation? No? Is it you who are going to operate?" The dress makes a difference. So they would feel I'm still young, not very confident. They can't have a good confidence in me to go under the knife. So, but see how it's just a mental block. They go for surgery to gynecologist, but the same thing for other than cesarean section or some other gynec surgery, other surgeries they don't want to go to a lady surgeon. So I slowly shifted to wearing saris. So that made a lot of difference.
Okay.
They said I'm more mature to be relied upon.
Okay, so the dress made so much of a difference. But
Yeah.
for you, Preeti, personally, when you were on that journey, since you had a classmate of yours also, but still you are less in number compared to the other classmates.
My classmate, she went off to UK afterwards.
Okay.
She's there in UK. So I'm here. I was here alone, and there was one more senior surgeon in Bangalore, much senior to me. So probably I was the second or third in Bangalore or Karnataka as a lady surgeon.
Okay.
Initially, it was little frustrating in the sense you would see problems which are related to only the bottom or the breast cases like that. But slowly it picked up. So once you gain the confidence of the patients, they'll come to you.
So how did you keep yourself motivated? What did you tell yourself to keep going on? Because sometimes it's like you said, it's frustrating, it's irritating. Like, did I take the right decision? Should I have listened to my parents? What kept you going in those?
I never looked back on that. I was very happy being a doctor. Like I would say, the people will come. That I'm a very patient person. Like I said, straightforward and very patient. Don't worry. And when your wants are less and your passion is there, you'll always wait without any regrets.
Okay. Okay. So today is a time when there
And
is.
same time, I had got married after MS. So the kids immediately, like I was already old, 28, 29 when I got married. So I wanted to complete the family. No, as a doctor, I didn't want to have children after 30 where the complications are more.
Yeah.
So that kept me busy. So I had enough time to bring up my children and do the practice also.
Okay. So you balanced it out very well. Life helped you also balance it out.
Yes.
But now looking back, Dr. Preeti, when you see because for me, that is a road that very few women take, which is a risk factor also.
Yeah.
But your intent was very pure. When you saw during your house urgency that women patients had this problem, and therefore the intention was very clear to you. And maybe somewhere that was the reason how you kept yourself together. What would you tell people, not only in medicine, but in any field, that when intent is pure, life doesn't immediately open all the gates for you? How do you keep yourself together? Yes, family is there, children are there, but there are moments when you are with yourself. How do you get yourself together? Because crumbling is the easiest thing that happens. How do you keep yourself together?
See, when you do a professional course or anything, it's your earning matters a lot.
Yeah.
So especially for men.
Here
I was other half of the family, so probably I could not. I could forego my earnings, and I am the type who will live in 1,000 rupees or lakh rupees also. I'm very content in what I always keep telling my juniors, and my professor would always say, when you start practicing, don't run behind money. You do your job, money will follow you. And the other thing I would tell was, if you buy a fan and if you still want to long for an AC, you'll never enjoy the fan, comfort of the fan.
Yes.
So be comfortable in whatever you have, whatever you can afford. That's it. That is for everybody, not only my profession. I keep telling everybody that. So that time my kids will say, "Ma, your lecture enough."
Simple but very practical advice. And I think that is where the challenge is most.
Enjoy for today when you long too much. You must have, there's a thin line between aspiration and wants. So aspiration is with passion you pursue. Wants is with greed. You try to fulfill.
Okay. And how do you differentiate the two? Like, how do you know it's passion and not greed? That's
when there are no regrets. Like you're not able to buy something what you want today, or you buy it tomorrow. That doesn't matter. Be happy with what you're having today and live for today.
Oh, okay. Okay. And as life progressed and you started getting your patients, now when you're looking back and you're connecting all those dots, what kept you on in saying that, Preeti, what you're doing is the right thing? Just move, just move, just passion, pure passion. That's it.
Pure passion. I think the basic nature of a person matters a lot.
Okay.
So I wanted to enjoy family life. I wanted to see the kids being brought up. I mean, it's see, I can do advantage of medicine is you can do practice anytime during your life.
Yes.
Whereas for other professions, that gap between two jobs matters a lot. For us, that is not the problem. So seeing the first child, first smile, first cry, I mean, the way first step they take, that you will not get it again.
Yeah.
So probably that's how I could manage in the initial. So I started the practice when the kids were small, when they were just born, maybe 6 months old, my daughter was, I started the practice. So I had enough time. Of course, there was a good support from my parents and my husband. That also matters. It's all my stars. So come till this far now, happily.